Hey, last week I shared my vision for Connecticut, which is rooted in the government's essential responsibility to take care of people. This week, I want to tell you about my ideas for how we ensure people are healthy, safe, and well supported, and why this matters so much to me. My parents met and fell in love working together in a hospital in Staten Island, New York. My dad went on to build and lead an internal medicine practice in East Haven for nearly 4 decades. And my mom is still practicing, today as an elementary school nurse. And so I grew up understanding that taking care of people is the most important thing we can do for one another. Now, well-being has many facets, from physical and mental health to safety and protections for vulnerable populations. And with advances in science and medicine, we should be able to provide these basic needs for folks. But I've heard from far too many people in our own community that they simply cannot afford health insurance, that they're forced to choose between paying the mortgage or the rent and paying their monthly premium. Now, over the last few years, a group of visionary legislators and healthcare advocates have been developing a public option to provide an affordable alternative to expensive private plans. If elected, I will help push this work forward and will protect Medicaid, push back against high deductible plans, and expand healthcare options for everyone in Connecticut. I'll also work on a variety of intersectional well-being and healthcare issues, from full reproductive rights for women to gun violence prevention. And I'm proud to share that I've earned the endorsement of Planned Parenthood Votes Connecticut and also the Moms Demand Action Gun Sense Candidate distinction. I will stand with the intellectual and developmental disabilities community, which is why I've taken the ARC pledge, and also with veterans and seniors, fighting for mental health and rehabilitation services, and also expanding senior tax relief and Medicare. Now, if all of these challenges weren't enough, we are of course today facing an unprecedented global health crisis. COVID-19 has taken the lives of over 190,000 Americans and is set to continue wreaking havoc on communities across our country with back to school and the impending flu season. And so protecting Connecticut citizens from the coronavirus has to be our #1 priority. As a legislator, I'll fight for expanded testing and contact tracing, and of course, affordable, accessible, responsive healthcare. And I'll put my trust in public health officials and healthcare professionals, folks like my parents who spent their entire career taking care of people and who are now in the best position to guide us through these challenging times. Thanks for listening, and thanks for sharing your experiences and stories as I've continued to develop my ideas. I hope you'll keep doing so, and I'll look forward to seeing you next week. Thanks. I'm John Michael Parker, and I approve this message.